Hi, my name is Pete Gordon, and I'm going to show you the Stop PU's app for the iPhone. Stop pressure ulcers, because pressure ulcers stink. So first of all, the iPhone app was developed such that it requires a login for nurses. So we're going to go ahead and log into the application as a test nurse. And we're going to see the patients that are already available to this nurse. So at this point, we've got 5 patients available, one of which has had a skin assessment and found a pressure ulcer wound. That's the red 1 to the right, and has a risk assessment score of 15, Chris George. At this point, we can go through and add skin assessments to each of the patients as needed, and we can add risk assessments, and as part of skin assessments, if we have identified any wounds, we can add that. We can also add a wound by just clicking on the patient image, like a double click, and the camera pops up, and we can take a picture of our wound and use that image and begin to fill in the details about the location of the wound, which is on the finger, and the length, and we'll say 1.2, and the width, and the depth, and probably most importantly, the pressure ulcer stage. So at this point, we can actually review the different pressure ulcers from the NPU-AP. And we'll say that this is a stage 2 pressure ulcer, and we can determine whether or not we want to go ahead and add additional details to the wound. So all of the pressure ulcer analysis model provided by HL7 that they've worked on for the past couple of years has been inputted into this system for the SNOMED CT and the LOINC compatibility. So we can, if it is a stage 3 pressure ulcer, we can go ahead and do undermining and tunneling and save that wound. At that point, we've got a wound for that patient immediately. And that is just the beginning, because here's a skin assessment we can also do on that patient. Now, you notice I came into the wound first by adding that, and now I'm adding the skin assessment. The fact is that a nurse may want to do a skin assessment, and then as part of a skin assessment, find a wound and need to add that. So they can do either direction. So there, I've added a wound and then filled in the skin assessment requirements for this patient, or I can go back to the patient's list and click on skin and then go to new and begin by adding the skin assessment for the general patient. Oh, the patient is a little pale, the moisture is moist because they've been sweating, temperature though is normal, and their the turgor or the dehydration seems to be good. So we'll add that as a skin assessment. Notice that the wounds have already been added to that that skin assessment. That's because the as you continue to add skin assessments every shift or every 4 hours, every 12 hours, then those wounds continue on until they're in a normal state. And some places have a requirement that how long they have to be normal. For example, a skilled nursing facility has to have maybe normal for 3 weeks in order to then clear it from their records. So this is the data associated with adding skin assessments and wounds and managing patients as they relate to the patient's wound themselves, the skin assessment, the risk assessment, which I haven't shown yet. We can add a new risk assessment, a Braden or a Norton. We can score it depending upon if it's a Braden or a Norton we can choose, and that will then show up in the skin assessment overview for the last risk assessment before that skin assessment. So this is wounds, risk assessments as part of skin assessments, and the overview of the patient, and going back to the patient list. All patients start with the number of wounds if there has been a skin assessment done. Here we'll go ahead and have a patient that has a skin assessment but doesn't have any wounds. We'll say the color is normal and moisture is normal and temperature is normal and turgor is normal and say done, and they have no wounds, a big 0 in that, and they don't have any risk assessments yet. So at that point when we did that skin assessment, so we can go ahead and add a risk assessment. We'll add a Braden risk assessment, and we'll say they're pretty medium risk, maybe patient, and we'll add that. Actually, that's not medium risk at all. That's not risky, but we'll go ahead and add another one. Maybe put them in a little bit lower on it, and there we go. We've got like a medium risk patient related to the Braden. So now if we go back and we maybe a few hours later do another skin assessment, say they're pretty normal at that time. Oops. I'm adding a wound, and I'll use that. So we found a wound with them, and we save it. And the turquoise is tenting, and we say done. And there we have one wound, and we have now a 16 on their Braden. So this is the overview for this patient. We come back, and that's Jane Doe. So you can see you can add skin assessment with wounds. You can add a risk assessment independent of the skin assessment. You can add a wound and then lead you to a skin assessment. This is capturing all of the data about pressure ulcers over time, so you can store them with the camera, images of those pressure ulcers, and it will track each one and give you that history. So now here's the really good part. In skilled nursing facilities and ICUs, we see this as a really breakthrough market for this type of capturing of data. But the best part of it is the integration in the EHR and PHR integration. So when you capture all this information, you do it as a nurse at the beginning of your shift. Get a list of the patients that come into the system from the EHR or the custom web application, which is on Azure in our case. And then when the shift is over, you come back in to the application, you end your shift export, and at that point are sending all of the data, all the images about the pressure ulcer images, the risk assessments, skin assessments with the wounds. You are sending that up to the custom application that integrates with Microsoft HealthVault, and all the patient information is then gone from your phone. So at that point, you then go over to Microsoft HealthVault, which was bound to that patient, and part of the information that you got for the starting of the shift was a list of the patients, including Microsoft HealthVault. And in the health information, I'm going to show you a couple samples in terms of the Braden skin assessment, where Microsoft HealthVault has two data types that were very relevant to this product, and that was the health assessment, which is basically a risk assessment in our case that we're using it, and a medical image study, which is DICOM, typically a DICOM image, but in this case we're using it for the pressure ulcer image. So we're going to come in here and take a look at some health assessments and see here the pressure ulcer risk assessment, and we're going to click on the details of that, and then we're going to see down here the Braden scores and the total scores when they were captured and the date time they were captured. And in addition to that, we're going to go back to the health information, and we're going to take a look at what's called the medical image study, and we're going to see some sample images that had been previously uploaded related to pressure ulcers, and these would come directly from the camera when given that the Azure application is pointed to by the mobile app, which is already in place as of this week. So here we're going to see the images, and we can see an entire series of pressure ulcer images up on Microsoft HealthVault. Now, the fact that we have the iPhone app, we have the Azure cloud-based application that's connected with Microsoft HealthVault, that gives us an integrated solution where eventually we can even tie into other EHRs. HealthVault standardizes on the CCD and the CDA. The data in the pressure ulcer is stored in an XML format so that this app can work in standalone mode just with the phone, and you don't have to necessarily have the Azure cloud services in order to talk to Microsoft HealthVault. But we expect that skilled nursing facilities, hospital ICUs are going to have the iPhone app integrated with the web cloud-based Azure application, which is HIPAA compliant with a business associate agreement, and from that be able to tie it directly into Microsoft HealthVault and into their own EHR systems, whether it be Epic or Cerner. So that is how we see the integration of mobile applications preventing, monitoring, tracking pressure ulcers, and integrating with electronic health records and personal health records like Microsoft HealthVault. Thank you.